I founded Desert Star Family Planning in 2013 because I wanted to bring comprehensive reproductive health care services to an underserved, medically underserved, ethnically diverse community. Arizona already had a lot of restrictions that basically concentrated abortion access to the Phoenix metro area.
The House has passed a bill 32-22 banning most abortions after 20 weeks of pregnancy.
There's a lot of laws that are impacting people's access to abortion care. As I started realizing how hard it was for people to access care, the advocate in me really kind of came to the forefront. We can create the most wonderful, beautiful ways to deliver care to people, but it doesn't matter if people can't access care. If I was going to really make some dents in the needs that I saw, then I was going to need to provide it through a nonprofit. I started the Desert Star Institute for Family Planning 4 years into owning the clinic, and 3 priorities are covered through that organization. One is training the next generation of abortion providers, providing long-term birth control to uninsured people, and providing community education and engagement. It's been a great opportunity to community build, organize, educate, as well as provide some patient assistance programs. I've had people from 19 states and 3 regions of Canada travel to Phoenix to train with me. Teaching is part of who I am. The way that medicine traditionally is taught is case-based, disease-based, system-based, and not whole person-based. When students come in with me, I tell them, what's the patient's name? When you say the patient's name, it calls in all of them, as opposed to that thing that you're discussing about them. Feels small and simple, but it's huge.
There was a brief period of time I was thinking about dropping out of medical school because there were a lot of significant value conflicts for me, and watching Dr. Taylor and how she sees medicine, how she sees her clinic work, made me realize that I can practice medicine in a way that is aligned with my values.
I am wanting to train up very competent providers as well as people who are advocates for reproductive health and justice in their communities. I was excited when I received the communication that I had been nominated. It's nice that it was recognizing how physicians can lead outside of medicine.
I actually had my own abortion. I reached out to Dr. Taylor after a recommendation from a friend. She just verified the results of the procedure I had had. Fast forward maybe 1 or 2 years after that, and I became elected to the State House of Representatives. We had a lot of attacks on reproductive health care, and Dr. Taylor was one of those individuals who came in and fought against those attacks.
Abortion is health care.
She would testify personally. She would participate in press conferences with us. She would share information with the legislators about what is better terminology when we're talking about these issues.
We have so much knowledge and experience, expertise to bring to tables. The people who are writing laws, creating policies, running institutions need to hear that. There is no shortage of people who need help. We need to stand up and say, we provide health care. Abortion is health care. It should not be criminalized.